eat the fresh food, and everywhere there are no diseases at that time. There was no disease at that time, but during when in this era there are so many diseases, and large amount of diseases are increased, and large amount of population has increased, but the government sector has not provided the such kind of facilities in healthcare, and and facilities, and government sector has a limited resources also. So that's why the private sector take place to fulfill the demand of the pupils, what they want from the health systems. So that's why we know that the private sector all over the world in comparison to the government sector.
Have you got her point? Yes, please. She is making a point, you are not enough capable, you do not have enough resources to fulfill the demands of public. That's why private sector has taken place in the market.
If we are talking about like the PK hospital and the AIMS hospital, they also have a very lot of technologies, and they also have the what we are called the EC machine, I guess. ECG machine.
ECG machines.
And they also have the extra X-ray scanners, and we all know that the private sector hospitals are very expensive. If you have a the small diseases like the fungal infection, if you have a fungal infection and just go to the hospital like the Metro and the very inexpensive hospital, they are charging more than 1.5 lakh rupees. So basically they are it's kind of business, they really don't even care about your health. And if you go for the government hospital, they charge only 5 rupees. Sometimes its cost is free. And if you're going to the AIMS, you will definitely get the best treatment.
Best and cheap
Treatment around the India.
Okay. Yes, what will you say? Like he's making a point, it has become only a business.
But we see that the patient load and waiting time is very high in government sector, because if we go in a government sector, overcrowded everywhere, and the facilities has limited, and if we go for a doctor to check up and for consultant, so they make a date for a duration of a long time, and we wait for a 1 year, 2 year. If we go to AIMS and we want to a surgery in AIMS for a free of cost, when we wait for 1 year or 2 years for the surgery. So that's why we need a private hospital, because it specialize everything. Because if you have the pain in your tooth, you also go on a dental hospital, and if you have a pain on a knee and fracture, you also go on a SSB, Metro, and there are so many hospitals take place in our cities.
India have unprivileged people more than the rich people who have money to afford cure in private hospitals, and unprivileged people don't have enough money to get cure in private hospitals, and that is why they are helpless and they have to go to the government hospital. And the government hospital provide cure in very cheap money.
As you say about the government hospital takes long time for treatment of a person. This is wrong. In last year, I went to private hospital, and my health condition is very serious. The people of the nurse of hospital says that you have to wait 1 day for.
Only wait for 1 day, na? But if you go on a government sector, you will wait for a 1 year or 2 year. If we talk about the AIMS, and if we talk about the which name? BK also. So they are also overcrowded, and if some woman went to the hospital for a labor, there are one bed, and there are so many women are let down 2 or 3 a woman lay down on a one bed and they all over the overcrowded and there are no cleanliness in government hospital. And if we talk about the cleanliness, there are higher quality of cleanliness in the private hospitals given by the authorities.
Government doctors and nurses have so much attitude. They do not behave anyone good.
Well,
Are you on private side?
okay, it's okay. Please speak.
So basically, she is saying the government nurses have so much attitude. I'm gonna tell something. My cousin have some kind of surgery in their leg. So basically, he go for the BK hospital. So first of all, if you say something about the you have to wait over 1 year or 2 years, it's not true. They have maintained hygiene. They maintain so much. They also maintain the crowd. So basically, it's depend on how you treat the government hospital. So you are the only one who create the mess, and you are the only one who responsible for the hygiene. So it depends on you. And second thing is
One thing I will tell you
It's
because when I am pregnant, when I went to the government hospital for the checkup and they give me for some test and I went to the I went to the toilet in a government so I run away from this time of the hospital. So I think this is the best condition in the cleanliness in government hospital.
ma'am, female toilets are much crossed in any hospitals, in any schools, and any kind of metro station. Because females are always like they have also throw some things in bathroom. No, it's not true. If you go for if you ask someone for a male, and the male bathrooms are always clean because females are responsible for this. And if you seen these types of things, you have to complain on the the high.
You have to complain to the
housekeeping people
authorities.
and the bathroom, whoever who take the responsibility for the bathroom, you can report the. And second thing, you just talk about the past.
If we
We
talk
are
about
not
the
in
reports and
2010.
complaint, if we talk about the reports and complaint of anything which is placed and held in the government hospitals, because there is no one to listen to your voice, and because you said because it's only government, because government provide the authority to all the peoples. But in private sector, if you have some things and accidental things to see in a private sector, and you will complain on the reception. There is a reception on private sector. They always listen to you and always work on your complaints.
Because they are charged like lakh of rupees.
Because
are
they give
giving-
they give the
better
facilities na. They give the
They give
facilities. They give
facilities
also
and they
facilities.
give good treatment.
Yeah,
We can't-
because the infrastructure, and they have the good machines and they have the skilled doctor. If somebody spend so much money on a MBBS or MD and especially why they went to for a government
Ma'am,
sector,
if you are talking about
because he also open your medical clinic, and he also go on a medical private sector for gaining so much weight.
Also, these people deserve these kind of gadgets, because the private hospital can be a option just for the rich people, because unprivileged people can't afford the private hospital fees. Because if we talk about the NSF, so 2015 report, so there is if we in the case of childbirth, the government charges 1,852 rupees, and if we talk about private, so it is 17,553. If we talk about then government hospital provide us in 1,778. If we talk about private, it is 13,374. So we see the difference between. If we talk about injuries, in government is 6,729.
This report can be wrong. This report can
No,
be
no,
No,
wrong.
ma'am,
it's
it
not
is on
it's
Google.
not a-
It is NSSO reports. You can see that.
Who provide the report? Who provides the reports?
MSSO.
Who provides the report? NSSO.
Yes, ma'am.
And if we talk about the government hospital. सर ये तो गूगल में चेक करें.
No, 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 ma'am. He is right. He has data.
He's very right.
He has data.
But let her speak now.
Just
Ma'am, if tomorrow Harvard University give any report on Google, you say that it is wrong.
If someone have an accident, and you can see that, or you can read
But
news on Google, and
private
you can
sector
say that it's
also
wrong.
private sector also provide the facilities to the poor people for their treatment. There are so many insurance policy and there are so many reimbursement policy and donations and there are so many facilities to provide the poor people.
I don't think so. It's very true. If you are employed for a MNC company, you have to pay the PF, and there is a lot of things. They are cut there from your salary, and if you go for the insurance, you can if you go for an insurance to claim your insurance to medical expenses and all these things, you can they are just treat you oh, welcome sir, welcome. No, not this type. They are treat you okay, this insurance and these things are not claimed in this insurance, and they are making the conditions right this time. Because if you are ill, and what's the benefit of insurance? And if you are talking about the donation,
If
I don't think so. There is a no donation.
If you go to the private hospital, they will at that moment they start the treatment of your pain and of your
And sir, government hospitals, doctors have not any greed for the from the patient because they have a fixed salary from the government. But private doctor's salary based on how many operations he did. So they will try to do more and more operations.
The injection cost
To
to
have
have
more and more
75,000 rupees. Let's think about it. The injection cost. There's a one single injection for 75. My friend have a she doesn't have a serious condition about her her kidney problems, and
if to suppose that if you have not got so much.
no, don't say ma'am, I can understand, please don't say that. In my entire life I don't even see the government hospital or the private hospital. I have a lot of experience of a government hospital, that's why I am
नहीं,
outside of
if
government
you are
hospital.
serious, if you are serious or someone serious ill, and if you go to the government hospital, you think sir the treatment will start at the
You have to wait now.
And sir, the patient is
so why we wait if the patient was in pain and he was in so much pain and everyone wants to go a private hospital because they think that the treatment is sudden of this disease.
Okay.
yes, ma'am, sir. Patients are on the elevator. He take his last breath, and the private hospital said, "Oh, this condition is so bad. Please pay 2 lakh rupees
injection.
on the क्या कहते हैं उसको?
ICU.
counter.
Bucket counter for the ICU.
Pay 2 lakh rupees
After
on the
that they
counter.
give the dead body.
Hmm.
After that they give the dead body in private hospitals.
There are they worried about the report of the death. If you see in private sector, the doctor are also worried about the death. If there are number of death increased in the hospital, the government will also check the reports and decrease the value of this hospital. So they never do this for the profit of anyone.
Imagine that someone have a 40,000 rupees salary and his expenses 25,000 rupees, and there is some guy or some another family member, and imagine if you are going for the private hospital, they will charge you the more than 2 lakh rupees or 3 lakh rupees. How can he pay? Think about it. He don't even have the insurance for their family. He just have insurance for their
So
own.
why he not taking the insurance? Everybody has to insurance.
Ma'am, do you know
Uh,
that
we did not-
you know about the
We
time.
did not know, ma'am.
Ma'am, do you know the charge of insurance? I'm also working in a health insurance. I'm also working in a life insurance company. Do you know the charge of the entire family?
Because there are so many plans, there are less plans, there are higher plans, there are the different type of insurance take place in our private sector.
How can somebody pay the 40,000 rupees annually for the 4 members?
Who earn only 10,000
Because
rupees.
if he thought, if he worried about the families and family members, so he can buy, because he expend so much money on their clothes, on their foods, and on their enjoyment purpose. So why he cannot expend the money on insurance?
I don't think so. Middle class family can enjoy the weekend. They just
Because it's
enjoy
about the lack of knowledge. If everybody has the insurance, because nobody know about that time.
Health insurance also the terms and conditions. We have to read the terms and conditions. They don't even involve the pregnancy. So that is the pre-planned and if you have an emergency, like if you have the accident, they just like the hospital will be charging more than 4 lakh rupees, and the insurance will be only 2 lakh rupees. How can you pay the remaining the 2 lakh of rupees?
The private hospital can vary a different type of cities, and if we go a small clinics, they cannot charge you 2 lakhs or 4 lakhs. If you go or a higher hospitals, you charge with, because they give the treatment at that level.
And sir, in past days, many cases took place.
If you go private hospital for some disease, if you go for a two disease, the doctor may charge only 300 fees.
Sir, in past days, many cases took place, like a middle class man who his wife, mother, father, anyone who is in the condition of death, and he want a best cure for his anyone who was, and he took his mother, father, anyone to the private hospital, and the private doctor said to him like his condition is very bad, and please pay 2 lakh rupees on counter. And he thought that, oh God, it is too much. How can I pay it? And then if they are helpless, and he have to sold their property papers and many expensive things, and their wife's jewelry, anything expensive thing, and they
Because they don't believe in government sector, na? Because they don't believe in government sector. Why go to the private sector?
He said
What is the reason? What is the reason he sold all the jewelry and the paper? Why he
Because he
go
don't
into the
have
private sector?
he thought that he have a great cure in private
Because
hospital.
he thought, na? He
Yes,
thought
he
he thought a
thought-
great cure.
not-
Great cure.
not-
Great cure.
it is
Quality
not
of
a fact,
treatment.
ma'am. He just
Quality of
thought it is
treatment.
not a fact.
Advanced
someone have a- if
advanced
someone have an
advanced
accident-
technology used in
If someone
private
have an
hospitals.
accident and they just go for the private hospital, your entire life saving will be ruined. Seriously, to be honest, you have to pay the fees and you have to pay the bill, and there is a time you have to save their
If government hospital provide the best facilities, as you say that, so why you give an example to that they ruined her life and they ruined his life, and why he is not going in the government sector for health condition?
Just give me the example, man. I'm not talking about the you go to the private hospital, because they don't even care about
Because
the
this
people, they
example
just care
against
about
you,
your money,
because this
man.
example against you, it shows that private hospitals is better than the government hospital.
Yes, ma'am, exactly. Because my bone TB operation is done on private hospital only 10,000 rupees.
How much you charge? How much they charge?
I don't know.
10,000. She said, 10,000 rupees only for the surgeries.
Only 1 year my operation is done.
What if
Because bone TB is long.
they charge only 10,000 rupees for 1 year? What kind
It's
of
a
hospital
Najibia
is that?
hospital. On the
Actually, that was not a hospital, it was like, clinic.
No, it's a hospital.
So clinic also the private, clinic also private.
But if you go for the clinic, they were like charge you for the 500 rupees for the 1 minute meeting. And if you had a
You know what? You know what? The private sector doctors are also open the clinic privately. Open the clinic for कमाने की क्या बोलेंगे?
For earning.
For earning.
So the private hospital owners want only money because if they care about the health of the patient. So when after the operation, when the culprit want to take her relative's body, then they did not allow to send give the body to her. Whenever he did not take the money to him.
Because he extract the some body parts from the dead bodies because the kidney and eyes also used in the other patients.
Then he want their money.
And if you go for the COVID-19 cases, there is a lot of private hospital doctors. They are taking the kidneys and they are taking the heart. And if you just tell me the one government hospital would be taking these steps, just tell me the one government hospital.
There are given example of surrounding. They give the kidney in a private hospital. How do you say that?
Ma'am, I'm gonna tell you the story. There is a doctor name was Vikas Gupta. He was taking the kidney from the patient, more than a 200 patient. Have
It's
you met
depend
him?
on the mentality
He
of a
just
doctor.
made the
It
life
can
of
be in
200
government and
people.
also in private. It can be private and in government also.
Ma'am, not in
So
government.
it's
I think
it's a
private
mentality.
Government
sector is a
hospitals
good,
have a like, so there is a lot of people, there is a lot of crowd. That's why they do not take the kidney. So you have to understand, sometimes crowd have a save you, and sometimes crowd have a like.
Last month, I went to the government hospital for the vaccination of my 4-month-old child. And the OPD will open for 2 hours. And they open and close according to their choices in government hospital, and there are so many long lines. Long lines, and my number is when I went to the hospital at 9 o'clock, and my number on the OPD at 1 o'clock. There is a lack of sources and lack of time and waiting time so much, and there is limited resources in government hospital, and I don't like the government hospitals.
Because ma'am, you are rich. That's why.
And if you really want, you can say that government hospitals can't afford the high level gadgets, but government also have gadgets, but it is able to save a patient's life.
And ma'am, if you just talk about the government hospital, doctors also open their own clinic. Well, it's not so much true. If you go for the private hospital, they are just taking the 2 hours of surgery, and the charge will be more than 1 lakh rupees. And if you are talking about the heart,
If surgery is successful, why not taking the charges of